My guest on this episode shares how courage, community, and advocacy have shaped her journey as a military spouse, mother, and public health professional. From navigating deployments with a newborn to earning her PhD while balancing family and work, she reflects on what it means to act despite fear, embrace growth, and build community across each chapter of her life. She speaks honestly about the challenges of employment, parenting, and mental health support in military life, and how she's using her voice to uplift and empower others. You're listening to the Courageous Public Health Podcast, Episode 16. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode.
Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting Firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation.
Dr. Chambraia Jones is a public health leader and strategist whose work centers on advancing health equity and improving outcomes for children and families. She currently serves as the Brilliant Cities and Strategy Manager, where she leads national expansion efforts for a model that builds neighborhood-based hubs supporting early childhood development and family well-being. Originally from Philadelphia and now living in California, Dr. Jones is a proud military spouse, mother of two, and a proud temple owl. Her research focuses on perinatal depression among military spouses, blending her lived experience with a deep commitment to maternal mental health. She brings over a decade of experience across global and domestic public health, with particular expertise in community health disparities, partnership building, program design, and data-driven strategies. Dr. Jones is passionate about systems change that is rooted with, for, and by the communities it serves. Let's connect my conversation with Dr. Chambraia Jones right now. Hi there, Chambraia Jones. So nice to have you on the podcast. How are you doing today?
Good. I'm so excited to be here. And thank you for this opportunity. I think just a wonderful platform to just discuss and talk and just like you said, open up space. So thank you for the opportunity.
Absolutely. I'm really excited that you are here. So Chambraia, you and I met on LinkedIn. And yes, like during the pandemic. And then we actually got a chance to meet during one of Dr. Charlotte Huntley's entrepreneur workshops in Orlando, which was really exciting. I didn't know you were going to be there. And it was like, yes, finally in person.
Yes, it was so totally funny. Remote. I had got so used to saying Dr. McClamrock, and you're like, oh, just Christy. And I was like, okay, Christy. Right. So it was very weird. But yeah, I didn't know you were going to be there either. And I was so glad. It was meant to be. So I'm so glad I got to meet you in person.
Absolutely. It was meant to be. So why don't you start by introducing yourself for our listeners?
Sure. Hello, everyone. My name is Chambraia Jones. I am a military spouse based in California. I'm originally from Philadelphia, so go Temple Owls, yes. I'm a mom of 2 beautiful children, and I've worked in public health sector for over 10 years in research, community health, and so it's been my life and my joy, and so glad that I found public health.
Public health is so glad that you found it.
Thank you. Thank you.
So I want to start by talking about courage, and just reminding everyone that bravery is about taking action without fear, while courage is taking action despite fear. And so I would love to hear from you about some experiences you've had in your professional life, and in your personal life where you've acted courageously.
Yeah, that word courage, that's something that comes up a lot, just in my life with talking to my children, all of that. For me, a big part of courage was, my life as a military spouse. Never in my wildest dreams I would even thought about being a military spouse. I didn't even know the ins and outs of the military, and, it happened, and I've been a Navy military spouse for almost 12 years now. And it was just it's been a wonderful experience, but also experience about tapping into myself. And I've learned a lot about myself through the process, having to move from one place to the next. You make friends, connections, and then you have to move again and rebuild. You lose jobs, and then try to connect with others. And so it's been a process, but not one that I regret, in any way. It really has allowed me to learn and grow about myself. And each place that I moved to, I was able to make a new connection, moving from, Philadelphia to Maryland to California, through all of that time. It helped me to kind of learn more about myself and about the public health sector in the sense of what that looks like in each space. I've worked for hospitals and kind of seen health disparities and inequities that people face within a hospital setting. And so I've learned about that part. I've learned about, the grant process of how, grants are being fulfilled within different communities. And so for me, moving and being this military spouse, I had to really dig deep and not give up because it's very easy to do that. My husband being deployed, and that's a scary thing. Deployment is, if you've never been through it, it's hard to describe, having to not know if your loved one is going to come back alive, safe, and all of the mental health disparities that happens when you go away as well. And so I think for myself, I allowed myself to feel these feelings and to not be afraid to kind of tap in to say, am I okay today? Am I not okay today? And it's okay not to be okay. And, from there, I was able to really connect with a lot of more military spouses through Facebook groups and support groups. But there needs to be more. There's not enough support for military spouses. They say it's in the research, but there's not enough to really make sure the military spouse has all the tools that he or she needs to continue to grow as you're moving throughout all of these spaces. And also from like the employment status, that space, it's hard. We need more grace, I would like to say, because this is a life, although we chose this life, you don't know what you're getting into until you actually get into it. And there are a lot of layers to being a military spouse. And so I would like people to give, more grace. The employment sector really needs to give more grace to military spouses. We uplift, of course, our spouses and be the backbone of the family while they're away. But it's a united front. So sometimes I feel like the respect is there for the service member, but not so much for the military spouse. And it's a unit, we move as a unit, and just like the service member has their space in and the job that they have to do, we also have a job that we have to do as well, which is equally as important. So I want to make sure that people know that. And for other military spouses out there that feel alone in any way, like, to make sure that they find that support system. That support system is very important, and find other military spouses, that they connect with and continue to build with. I think it's very important.
So had you already had your son when your husband was deployed?
Yes. So my son was about 9 months old when my husband deployed. Yes. So yeah, it was really tough. But I think I kind of dug deep in the sense of like, I was raised by a very strong mom, and I saw her work and do everything. And so for me, it was like, I don't have any other choice but to, do the things I need to do and really, pour myself into this little boy, and for us to just kind of go through this together, because I didn't have any family at that time. So in San Diego, we were stationed in San Diego at the time, and so I didn't have any family support. We just moved there and all of that, and so I had our son in California, in San Diego, and then I didn't have any family that came out or anything like that. So it was just us, just kind of making it through. So after that, my husband got deployed, so it was like very, very abrupt. But, I made sure that I try to, connect with all the resources I possibly could through, looking at Facebook groups, at the installation sites, talking to Family Readiness to figure out, what are some other support groups I can join or people I can talk to. And it's also from the employment perspective. For me, it was like, prior to this, I had, worked in various communities and public health, and I loved it so much. And then I had this, this abrupt, like, okay, I can't do this right now because I have to focus on my son. And so it was that mindset of saying, okay, this is temporary, but what can I do right now that's allowing me to continue to connect with people, And so from there, I found myself, because I breastfed my son, just kind of posting online about, breastfeeding. And I found other moms, other military spouses that were struggling. And so, I don't know, it became a unique thing of just kind of supporting each other. And so I ended up getting a certification as a breastfeeding specialist during that time, because I was able to make these connections that I didn't even know I was going to make. And also while doing that, I was able to connect with a wonderful organization. And I'm going to, Freedom Makers is the name of the organization. I'm going to tell you that because that was, I feel like a pivotal job for me in the space of, that is an organization that hires military spouses and outsource jobs. It's a virtual assistant position, but you're able to, still kind of tap into maybe some skills and some things that you maybe have never tapped into while still making a living for yourself. And it's a very wonderful organization. So for me, that was that organization I was able to connect with and be with for some time while I was raising my son, while my husband was deployed. And so, yeah, Freedom Makers, I love. So for any other military spouses out there, Freedom Makers, I would say definitely connect with them as well. It's a great organization.
I mean, this is a lot. There's a lot of good stuff in here. And I know that, like, on top of all of this, then you decided to get your PhD.
Yes. Yes. It took some time. And it was funny. I had this conversation with my husband because I was, at this time I had worked in so many avenues of public health that were amazing. And I, always like to learn about new things. And so I was just thinking to myself, what haven't I done before and that I need to do? And this was after I started working in global health. At that time, I had never traveled before at all, never been out of the country. And I found myself in wonderful places like Botswana and Sierra Leone and all these places of learning that aspect of public health. But after that, I just felt like, I needed more. I felt like I wanted to be in a space where I had never been in before. And that cliche word of or phrase of having a seat at the table. I felt like although I was working in an organization that I loved and I felt like I was growing, I still felt like that I was seen but not heard. if that makes sense.
Yeah.
And not to say that no one valued some of the things that I was saying or things that I could bring to the forefront, but I felt like, hey, if I went for this PhD, I feel like maybe that seat at the table will happen. And also for me to build myself up in the sense of like, I can do this. When people talk about, I'm sure for you as well, when people talk about PhDs, it's kind of like this scary thing, like, okay, like no one can accomplish this, or it's very hard to accomplish. And although it is, it has less to do about, of course, the work is important, the research, that's so important because you're exposing new gaps and things that, maybe people have not touched upon or need to be expanded upon. But it's more about yourself as an individual to grow and keep pouring yourself into the work and pushing yourself. And so when I started that PhD, I actually started it during the pandemic. And yeah.
Wow.
And, yes. And the thing was, I told no one at my organization that I started this. Also because I was one of the few, women of color there. And I felt like if I dropped the ball in any way in my job, I didn't want anyone to say, well, it was because she's starting this PhD or it's because she's pouring herself into that. So I told no one. I maybe told one of my colleagues, and he was great about like, not saying anything. But when I finally decided to leave, and nothing dropped, I'll tell you that. I kept everything in rotation. So everything was great. But when I decided to leave and I said, I'm going to leave because I really want to focus on my family and I really want to focus on some other things. And, on top of this, I'm getting my PhD, and it was a complete shock. Like, oh, you were doing this while you were working here? And I was like, yes, of course, full time and all of that. And so, I was proud of myself in that sense of like speaking up, but I also felt like, wow, I really had to like kind of cut myself off in the sense I couldn't celebrate my win of going through this process because I was afraid in the sense of the backlash or having to, of course, that part of like working harder than everybody else and wanting to be seen and heard at the same time and respected in the field. So that part of me too was like, kind of sad for myself that I had to do that, but also proud that I got to where I was in the process and that I didn't give up also. So yeah, it was tough.
And you're going to be done with your PhD. You will be Dr. Jones when? In just a couple months, right?
Yes, in July. Yes, I'm so excited. And I'm actually doing my dissertation is on perinatal depression amongst military spouses. So yeah, it's been wonderful. It's been a wonderful journey of really getting the feedback and also support. I collected my research, primary data collection through Facebook groups because I've been a part of all of these Facebook groups. And so it was really, as much as some of it was a little hard because, if, some of the Facebook leaders were kind of like, oh, this feels like a little bit infiltration and we don't want you kind of poking. And I get that, but I also got some amazing responses from a lot of military spouses that said like, this is very much needed. Thank you for asking these questions and wanting to know like once I'm done, if I can share it. And of course I will, but it's been great just to kind of go full circle of really seeing myself kind of grow as a military spouse of like not knowing anything in this space. And then now feeling like I can be an advocate in this space as well.
I think it's really cool that you collected your data through Facebook groups. That's, it's like moving into, 2025 or what,
Yes.
That's not something, that's a whole new methodology.
Definitely. No. And there's a lot to be learned too. There's a lot of red tape that people don't know about when you're going through these processes too. So it's a lot of things that I learned too. So, I've enjoyed this process. Definitely.
Yeah. Great. So, I want to ask you about the ways that you claim and express your power, especially in spaces that may not always welcome it. And I think you've touched on this a little bit, but, yeah. Any thoughts about that?
I think for me, I don't know, it's all about growth. I think, and I feel like I'm over 30. I just turned 38. So, I feel like something happens, and people always say like after you turn 30. I just felt like, not that I'm going through it and saying, oh, I don't want to have a filter or anything like that, but I just felt like I got in such a space for myself to dig deep and say, I'm not afraid of anything anymore. Like, I'm going to speak up. And like that part of like speaking up is something, like I said, I talked to my son about. He's 9 years old, and the power of your words in those spaces are so important, because as you're connecting with people, you don't know who you're going to touch. You don't know what someone else is going through. And also it's a way for you to kind of have that connection of things that you didn't even know you were going through, but by connecting on a particular topic or thing really opens up a whole new world. And so for me, it's that power of being comfortable in your own skin through this process, and knowing like with public health is ever changing. There's so many things that are happening at the same time. There's so many avenues to tap into. And so I feel like in being a public health change maker, you have to be uncomfortable with uncomfortable conversations. Like you have to be willing to speak up when other people may feel uncomfortable to speak up. And I've learned that through the process of, the wonderful organizations I've been able to work for, because I saw the disparities, I saw the inequities, and I would say like, oh, this is not right. Like we need to say something. And, there were spaces, of course, where people would say, oh, I don't think you should say that. And, everyone has their own opinion and things. But for me, I noticed that there's either one of two things is going to happen. If you don't say something, change is never going to happen. And if you do say something, there's a chance that change won't happen, but at least you got it off your chest and you get people thinking about another way to figure out, how to fix a problem that they may have never thought of. And so for me, as I've continued on this journey, I've said I have to speak up even when it's uncomfortable.
Yeah, the idea that, if you don't say something, there's definitely not going to be change.
Right.
Right.
Yeah.
And if you do, there's a possibility.
Right.
Yeah. No, that's really true, and an important piece of all of this, right? About like claiming your power. Yeah.
Yeah, definitely.
So I am really interested to hear about your vision. So in terms of looking ahead, in terms of looking towards the future, and let's start with your vision for, maybe it's public health, maybe it's for BIPOC communities, how you see BIPOC women shaping these futures. I would love to hear about that.
Yeah, I've had the wonderful, unique, pleasure of like, I'll connect with people randomly on LinkedIn. Like if I see someone on there, I'm like, hey, they're doing some amazing work, I'll email them, and some people respond and some people don't. But, I feel like a lot of times there's this stigma of, BIPOC women and communities of just kind of this crab in a barrel mentality, right? Of no one wanting to see anyone shine, so to speak. And I feel like we're such in a unique space of uplifting one another. Like my vision is to unite, and, as cliche as that sounds, there is space for everyone. And I feel like if we have these spaces to connect and really uplift one another, we can make huge changes. I'm a part of a lot of these groups, these Facebook groups, and, people are going through all sorts of things of, job insecurity and so many things that are happening. And I feel like there needs to be a space, like yours, like what you're doing, where women can come together specifically. I feel like for everyone, but for women to come together specifically to talk about, struggles, things that they want to change within their communities, because I feel like you need everyone on board to do this. And like my vision is to, connect the dots, to fill those gaps, and to make sure that people have a space, have a voice, and to talk about things that are affecting them. I feel like we have these personal things that are affecting us, and then we have job things that are affecting us, but at some point they get, integrated, and they become one of the same. And so for me, I would like to see more platforms where women can come together and speak about these things and uplift one another and talk about, collaboration. I feel like that is everything. A lot of times we all have the same ideas, but different ways in how we want to execute them. And so I feel like having these conversations will help us to kind of really pinpoint of like, hey, how can we make this change? No matter how big or small. And I feel like sometimes in a lot of our communities, people are intimidated by what's being seen on social media, or intimidated by, certain figures or maybe things that they consider as power. But we all have power, whether you tapped into it or not. We all have power. And so we all have to figure out, okay, what is a way that we want to make change? How do we identify with power? What is our definition for that? And whatever that is, no matter how big or small that is, it's important to fulfill that and execute that. And so, for me, I would love to, create an organization where I have women from all different facets of life, all different educational backgrounds, and have a way in which we can connect on our work and collaborate, but also outsource to people that need, help with grant writing, with researching and whatever it is. I kind of want to have that power group of people that can execute all of these wonderful things and also show, kids as a mom as well. I feel like I want to be example. And, people say example as someone that doesn't make mistakes. No, I want to be an example in the sense that I'm able to show my son and my daughter what it is to fight for change, what it is to not give up on yourself, what it looks like to keep pushing forward, to speak up for yourself, and to not be afraid to make change. And that even them, just one person can make a change. And we say that all the time. It's like, again, we talk about these cliches, but you really can make a change with just being what you want to do as yourself. And you don't know who you're going to affect and touch. So, that's what I would like to see going forward. That's my vision.
And I love that that's something that you're going to teach your children, right? You're going to teach your children that they have power because they do. And you're going to teach them about courage. And I mean, it's so important to set the next generation up to be able to continue the work of fighting for equity and public health. So is there anything else that is part of your personal vision for your future?
I think for me, personally, I don't know. I'm in a space of learning. I just love to learn new things. And so I'm taking each thing as it comes. Like I said, with this PhD and this dissertation has been such a big part of my life. And so I'm, my husband calls me a professional student. He's like, so when this goes away, what else are you going to do? You're going to sign up for school again? And so I'm like, well, no, but I'm sure there's something else that I feel like I'm going to get into and I'll have the space. I've been in school, like even though I took a break before starting the PhD, but I had been in school for, 10 years, like trajectory of like, after doing undergrad, I went right into my master's and then I worked. And so I'm looking forward to that space of not having school in the picture and really be able to figure out my professional goals going forward. I think for me too, it's like, I love connecting with people. So I know that's going to be a big part of what I want to do is continue to connect with others. Whether it's, high school students. That was one of my first jobs, tutoring at a library. I worked with kids for the longest. And so a big part of me, I really want to continue to uplift the youth and really tap into that. And like, whatever it is that they need, I want to be there. Like, you need help with like FAFSA, you need help with a resume. Like, I've done all these things. And so I really want kids to feel like they can tap into other tools and resources, and not just college. College is not for everyone, but having a plan and a goal set for yourself, whether it's starting a business for yourself. I want kids to be able to, open up their minds in those spaces. I want to have those conversations because I feel like sometimes things are a little one track when it comes to the trajectory of school. And, there's a lot of influence from other things. But I really want to continue to connect with my community and especially the youth and women, of course, and moms and military spouses and any way I can help. I just want to be able to do that.
I feel like your husband is probably right that you will find other ways to learn, right?
Yes.
Whether it's like taking a, basket weaving class or something
Exactly. Yes.
Yeah, I've been a little bit that way as well, where it's like, I want to be learning for the rest of my life, right? Like as long as I'm here, I want to keep learning.
Exactly.
Yeah.
Exactly.
Yeah. So this has been really, really great. I am so grateful that you came on the podcast. I want to find out how our listeners can connect with you, especially because you are so active on social media.
Thank you so much. No, LinkedIn is the best way to contact me. And please, I'm that person that I will reach out to anyone. Like I said, if I come across someone, I'm like, oh, they seem like an interesting career that they have. Let me reach out to them. Whether they get back to me or not, I still reach out. So please, if you have any questions about anything, I'm more than happy to get on a call, to have a conversation. I love talking with new people and also for myself. It's not just for them. It's for myself to kind of continue to grow and learn as a professional as well. So I welcome any questions in. So I look forward to it.
Fantastic. That's great. We'll include your LinkedIn information in our show notes. So I love your energy so much.
Thank you.
I really do. You just bring this. You know what I wanted to say? So tell us what's on your t-shirt before we go.
Oh, sure. Yes.
Yeah.
So
can you
see
it?
Yes. Let's see. So my best friend, actually, I met her when I went to school at Temple. And so we've been friends for over 10 years. But she sent me this shirt because we're always having these conversations. And so it says, embrace kindness, embrace mindfulness, embrace empathy, embrace joy, embrace life, embrace happiness. And so I feel like, those are all things that I try to live by because it takes nothing to be kind. And so, embracing all of these wonderful things is just kind of putting that positivity out in the world and getting the positivity back. So, yeah.
I also love t-shirts that say something about what my vision is and what my values are.
You always have wonderful t-shirts. I remember your t-shirts that you have. Yeah.
Thank you. Yeah. So I was like, okay, we gotta tell our listeners what's on that t-shirt.
Yes.
Well, thank you so much, Chambraia. I really appreciate you. And it's been a pleasure to reconnect.
Yes. Thank you so much, Christy. Thank you for this platform. I wish you much success with it. And I look forward to listening to all the other wonderful conversations that you're going to have.
Thank you. Sometimes courage is starting over in a new place with no safety net. Sometimes courage is finding community in unexpected spaces. And sometimes courage is speaking up even when your voice shakes. Dr. Chambraia Jones reminds us that courage is about lifting others as we rise and creating spaces where everyone belongs. You can connect with Dr. Jones on LinkedIn to learn more about her and her courage. All the links to connect with her are on our show notes page for this episode, located on our website, courageouspublichealth.com, under episode 16. Before you return to your day, think of someone in your life who would be moved by this conversation. Take a moment to share this episode with them. If you're listening on a podcast app, you can send it via text or share directly to social media. And if you're on our website, the sharing buttons make it easy to spread the word. Thanks so much for being here. Until our next episode, stay courageous.
Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.